video we will talk about anatomy and physiology of kidney. We will learn in detail about anatomy of kidney, blood supply to kidney, function of nephron, parts of nephron, types of nephron, functions of kidney, and renin-angiotensin-aldosterone system. Kidneys are located above the waist in upper abdominal area against the back muscles. They are located below the rib cage, one on each side of the spine. The ribs and muscles of the back protect the kidney from external damage. In this picture, you can see the ribs are protecting the kidneys. The left kidney is located slightly higher as compared to the right kidney. In this image, you can see the position of left kidney with respect to the position of the right kidney. The left kidney is slightly higher as compared to the right kidney. Kidneys lie behind the peritoneum, which is a lining of abdominal cavity. In this picture, you can see the organs present in front of the kidneys are removed to show the position of the kidneys. Right kidney is located below the diaphragm and behind the liver. In this picture, you can see the position of liver with respect to right kidney. The right kidney, as you can see, is located behind the liver. In this image, you can see the position of kidneys in relation to diaphragm. The kidneys are located beneath the diaphragm. Left kidney is located below the diaphragm and posterior to the spleen. The left kidney is located behind or posterior to the spleen. Kidneys are protected by pads of fat and by the last two pair of ribs. An adult kidney is 10 to 12 centimeters long and 5 to 7 centimeters wide and 3 centimeters thick. It has a mass of about 135 to 150 grams. A tough fibrous outer capsule holds each kidney together. In this image, you can see the fibrous capsule which is covering the kidney. Under the fibrous capsule is the renal cortex. This region is known as the renal cortex. Cortex is present just beneath the fibrous capsule. As you can see, kidneys cross section here. Superficial smooth textured reddish area, as discussed previously, is known as the renal cortex. Deep reddish brown inner region is called renal medulla or medulla. This portion is known as medulla or renal medulla. Medulla consists of 8 to 18 cone-shaped structures called pyramids. These structures are known as renal pyramids, which are present in the medulla region. Points of pyramids is called papilla. This portion here is known as the renal papilla. Papillary ducts drain into a cup-like structure called the minor calyx, subsequently forming the major calyx. This portion is known as the minor calyx. This portion is known as the major calyx. Renal pelvis. From the major calyx, urine drops down to a single cavity called the renal pelvis. Here, as you can see, the major calyx altogether are forming the renal pelvis. Renal pelvis transfers the urine to the ureters. Ureters collect urine from both the kidney and transfer to the urinary bladder. Bladder then stores urine till it leaves the body through urethra. The following is a summary of how urine is formed and moves within the kidney. As we have discussed, urine passes from renal pyramid to papillary ducts, eventually moving on to minor calyx, major calyx, then moving on to renal pelvis, and then the urine move towards the ureters, finally draining into urinary bladder till it is moved out of the body through the urethra. Let us now look at the blood supply of kidney. Renal artery is a part of larger artery called aorta. In this image, you can see the aorta, which is giving the blood supply to the kidney in the form of renal artery. Renal artery. Renal artery divides into various segments to enter in between the renal pyramids. In this picture, you can see the renal artery dividing into various sections of kidney to give the blood supply. Renal vein collects the blood from various segments of renal pyramid to form a vein. In the next video, we will talk about nephron.